Hello everyone, welcome back to CPC EDA. In today's video, we are going to analyze the questions and answers from last week's CPC exam, that is September 30th date. This video will give you valuable insights into the most recent exam pattern and help you prepare for your upcoming CPC exams. Let's see with the first section and medical terminology and anatomy. In this section, they have asked about spleen. Spleen belongs to which system? And adrenal gland also belongs to which system, they have asked on this. And electromyography also they have asked, and conjunctivitis, trichomyosis, neuralgia, colposcopy, and urticaria. These questions they have asked in CPC exam, which held on 9:30 September 30. Okay, spleen belongs to lymphatic system, adrenal gland belongs to endocrine system, and electromyography, health of the muscles they are going to check, and conjunctivitis, inflammation of the conjunctiva, and trichomyosis, condition related to hair, and neuralgia, plain along to the course of the nerve, colposcopy, a procedure to closely examine the cervix, vagina, and vulva for signs of diseases, urticaria, a skin reaction characterized by the itchy wells, and urticaria also known as hives. Okay, these questions they have asked in exam. And let's see the zero series. From zero series they have asked around four questions. Okay, around four questions they have asked, and first question is anesthesia for open procedures involving hip joint, total hip arthroplasty. They have asked the anesthesia for total hip arthroplasty, and code is 01214. Okay, and next question they have asked about vaginal delivery only, anesthesia for vaginal delivery only, and the code is 01960. So, and will next question they have asked on anesthesia for intracranial procedures, craniotomy or craniectomy for evacuation of hematoma, and the code is 0211. And next question, anesthesia for procedures on integumentary system. So next question they have asked anesthesia for procedures on the integumentary system on the extremities, anterior trunk and peritoneum not otherwise specified, and the code is 00400. These four questions they have asked from anesthesia part, and from first series they have asked around six questions. From first series they have checked on debridement, muscle under fascia, including epidermis, dermis, and subcutaneous tissue, if found first 20 square centimeter or less than it. First 20 square centimeter or less. And the code is 11043. And next question, they have asked on pairing and cutting. Pairing and cutting of benign hyperkeratotic lesion, that is for single lesion, but they have asked on more than four lesions, and the answer is 11057. Okay, and next question they have asked about skin tags removal of skin tags, and the for removal of skin tags, multiple fibrotenous tags up to 15 lesions, that is first code for 15 lesions and additional 10 lesions. They have asked additional 10, total 25 lesions they have asked. First 15 lesions we have to code 11200 main code, and additional 10 lesions we have to code 11201 as additional code. Okay, in this question two codes applicable. And next question they have asked on intermediate repairs, and the code is 12032. They have asked about intermediate repairs, wound of scalp, axilla, trunk, and or extremities. It is about 2.6 centimeter to 7.6 centimeters they have asked. Okay, first code is 2.5 centimeter or less than that one. Second code is 12032 2.6 centimeter to 7.6 centimeter, and they have asked that question 12032. And next question, they asked about adjacent tissue transfer or rearrangement. Adjacent tissue transfer or rearrangement: forehead, cheeks, chin, mouth, neck, axilla, genitalia, hands and or feet. Defect 10 square centimeter or less. This question they have asked, and answer is 14040. And next question they have asked about Mons surgery. Okay, Mons microscopic technique, and all three codes are applicable for that. They are asking Mons microscopic technique, including removal of all gross tumor, surgical excision of tissue specimens, mapping, color coding of specimens. Okay, this is for first stage, and each additional stage after the first stage up to 5 tissue blocks, on additional code, and each additional block after first 5 tissue blocks. So first 5 tissue blocks, this is the additional code, and after first 5 tissue blocks, each additional block you have to add 17315 also. Okay, so 17311, 17312, 17315, all these three codes applicable for this question. Okay, this for first stage, 17311 first stage, and 17312 each additional stage after first stage up to 5 tissue blocks. Okay, 17315 is for after 5 tissue blocks each additional tissue block, 17315. Okay, and next we'll move on to two series codes. And two series codes they have checked on gunshot wound. Okay, 20101, exploration of penetrating wound on chest they have asked. 20101, exploration of penetrating wound on chest. They are asking about gunshot wound chest, 20101. And next they are checking on trigger point injections. Trigger point injection 20553 they have asked. 20553 code for injections, singular multiple trigger points, 3 or more muscles. Okay, 00552 is 1 or 2 muscles, and 20553 is 3 or more muscles, and they checked on trigger point injection, singular multiple trigger points, 3 or more muscles. And next question they checked on excision of 21012 for 2 centimeter or greater than that. Excision tumor, soft tissue of face or scalp, subcutaneous, less than 2 centimeter is 21011, and 2 centimeter or greater than that is 21012, and this one they have asked. Okay, and next question they touched on manipulation part. Manipulation 21073, manipulation of temporomandibular joints, therapeutic, requiring an anesthesia service, is direct question. No additional codes also for this 21073, manipulation of temporomandibular joints, therapeutic. And next they asked an CPT code for orthodesis. Orthodesis topic they asked. This is also direct question. Orthodesis grade 2 they asked, metatarsophalangeal joint, grade 2. So orthodesis 28750. Answer for this question 28750. And they asked an removal or repair. Removal or repair they asked this one. Okay. So removal or repair. of cast removals 29705 our code is the answer. They ask removal or bevolving gunlet, boot or body cast, that is for 29700. 29701 full arm or full leg cast, full arm or full leg cast, this one they asked on the paper. Okay, next we'll go to third series. From third series they asked an incision 31002. 31002. 31002 is for lavage by cannulation sphenoid sinus. Okay, sphenoid sinus. They asked about lavage by cannulation sphenoid sinus 31002. And next question they asked on sinus endoscopy. Sinus endoscopy they touched 31290 for the direct answer. Nasal sinus endoscopy surgical with repair of cerebrospinal fluid leak, ethmoid region. Ethmoid region. They asked sinus endoscopy, ethmoid region. 31290 is the answer for that. And they asked an endoscopy. 31510 endoscopy. The right answer 31510. Laryngoscopy, indirect diagnostic with biopsy. Diagnostic with biopsy 31510. They asked 31510 laryngoscopy, indirect diagnostic with biopsy. Okay. And next question they asked peripherally inserted central venous catheters. They asked on central venous catheters and they asked about age 5 years or older than that. Insertion of peripherally inserted central venous catheter without subcutaneous port or pump, including all imaging guidance, image documentation, and all associated radiological supervision and interpretation required to perform the insertion. And first code is for younger than 5 years of age. And they asked above 5 years. 5 years or above 5 years. So you have to check age carefully in this. Okay, 36573 is the answer for this question. And next from 4 series they asked biopsy of salivary gland. Okay, biopsy of salivary gland 42400 is the answer. And next question they touched on esophagoscopy. Okay, esophagoscopy they asked 43196. Okay, esophagoscopy 43196. Esophagoscopy rigid transoral diagnostic including collection of specimens by brushing or washing when performed. Okay, 43196 with insertion of guide wire. Okay, with insertion of guide wire. Esophagoscopy rigid transoral diagnostic including collection of specimens by brushing or washing when performed with insertion of guide wire followed by dilation over guide wire. This one they have asked in the exam 43196. Okay. And next question 43260. Endoscopic retrograde cholangiopancreatography ERCP. They touched on ERCP. And endoscopic retrograde cholangiopancreatography diagnostic including collection of specimens by brushing or washing when performed. Separately they asked and 43060 is the right answer for this. And next question laparoscopy they asked on laparoscopy surgical appendectomy and 44970 is the right answer. Okay. And next question from sigmoidoscopy they have asked proctosigmoidoscopy, rigid diagnostic with or without collection of specimen by brushing or washing, with ablation of tumors, polyps or other lesions. Asked with ablation of tumors, polyps or other lesions. 45320 is the right answer. Okay. And next question they asked on measuring total length of anterior abdominal hernias. From hernia they have asked. Okay. From hernia they have asked. They asked on repair of anterior abdominal hernias greater than 10 centimeter incarcerated strangulated. Incarcerated or strangulated. 49618. Repair abdominal hernias greater than 10 centimeter incarcerated or strangulated. They are asking 49618 is the right answer. And next 5 series. From 5 series they asked on nephrectomy including partial uretectomy. Ureterectomy. Okay, any approach including rib resection. Okay, so nephrectomy 50220 is the answer for that. And next question, litholepaxy. Litholepaxy complicated or large over 2.5 centimeter. Okay, first one is less than 2.5 centimeters and they are asking complicated or large over 2.5 centimeter. They are asking. So 52318 is the answer. And next question they have asked circumcision, surgical excision other than clamp device or dorsal slit. Neonate 28 days of age or less than that. They are asking neonate, circumcision, surgical excision other than clamp device or dorsal slit. Neonate they are asking. So 54160 is the correct answer for this. And they also asked on intersex surgery. Okay, intersex surgery, female to male. Okay, male to female is one code is there, female to male another code is they are asking female to male question. 55980 is the answer. Okay, and next they have asked on hysteroscopy diagnostic. Hysteroscopy diagnostic 58555 is the answer. 58555. And next 6 series. From 6 series they asked on excision of parathyroid, thymus, adrenal glands, pancreas and carotid body. In this topic they have asked. So they asked on parathyroidectomy or exploration of parathyroid. Direct question 60500 is the right answer. And next they asked on craniectomy or craniotomy. Craniectomy or craniotomy, intracerebral they asked. Okay. Craniectomy or craniotomy for evaluation of hematoma. Okay.